2012 marked Ochsner's 70th anniversary as the premier healthcare system of the South. Throughout the years, Ochsner has faced many changes and challenges, and 2012 was no different. But as always, Ochsner successfully embraced them. The reason for our ability to handle change and adversity is that Alton Ochsner's creed and what it stands for are still constant in our culture today. His core principles of determination, having a positive attitude, being honest, loyal, and to always strive for self-improvement are as alive today as they were in 1942. With a connection to the creed, Ochsner looks to our plan to be the best in order to remain at the forefront of healthcare. We must prove our value, continue to grow, drive waste reduction, and build for the future.
One must not forget we're treating individuals, we're treating human beings who are ill rather than treating a disease. Because if we forget the individual, we're likely to fail.
Ochsner's group practice and its commitment to high-quality health care culminated in 2012 with becoming one of only 25 hospitals in the nation ranked on the U.S. News and World Report's Best Hospitals list for having 11 or more specialties.
To me, this is hitting it out of the ballpark. When you're reaching that top threshold of best places in the United States, it's a wonderful team accolade.
This is why I think all of us came, is to be able to be in an organization, a group practice, a hospital, where we could get together and have these kinds of results and make this difference.
Ochsner's value to the community was recognized through our nurses with 9 Daisy Awards for exceptional nurses, 22 of our nurses making Louisiana's Best 100 Nurses, and Ochsner being named as a best place to work by City Business Magazine for the 7th year in a row. We rely on our employees to make a difference with our patients. Ochsner's messages, strategy, and news were delivered to highlight the impact each one of us has on every patient through a dynamic internal communications platform called The Power of One. And to deliver on Ochsner's ability to commit its exceptional care to patients wherever they are, the compelling Connections campaign was broadcast throughout the region.
Being connected. Another reason to choose an Ochsner-affiliated physician.
If I just like to be the best that I possibly can, I try to make the use of the God-given talents that the Lord gave me.
2012 welcomed new CEO Warner Thomas, who builds on the dynamic leadership demonstrated by Dr. Patrick Quinlan.
So I think back, whether it's when we did the merger in 2001 or sold the health plan in 2004 or went through Katrina in 2005, all of those events were really about a team effort. And that's what makes Ochsner so great. It's about a whole group of people that work together to make Ochsner a success.
With the ever-changing healthcare landscape, Ochsner maintains its steadfast focus on the patient. State-of-the-art facilities and services were expanded to treat and care for patients from the region to around the world. 2012 saw the expansion of our telemedicine services. Our EICU and telestroke programs are giving patients outside the area a connection to Ochsner's specialty care.
So more and more, the technology is catching up with the desire to outreach and share care across vast areas.
So we can deliver the highest quality Ochsner care in all of our ICUs.
By connecting outstanding patient care with communities farther away, Ochsner has become the regional referral center. In fact, in 2012, the center reached a new milestone and exceeded 5,000 patient transfers. To expand and improve services to patients, Ochsner's philanthropy department has stepped up their efforts, hosting several successful events. And as a show of their commitment and loyalty, Ochsner employees have raised over $900,000. Through partnerships, Ochsner is bringing its expertise further into regional, national, and global communities. Ochsner academics continue to expand with international efforts in the Middle East, Latin America, and the Caribbean. Coming full circle, 2012 marked the first class of new physicians to complete the University of Queensland Ochsner Clinical School program since it began in January of 2009.
It really cements the fact that we are the fourth medical school in the state of Louisiana, and it also demonstrates that we're a real player globally in medical education.
Our primary objective is quality patient care at reasonable cost.
With cuts in reimbursements and increasing healthcare costs, Ochsner set out with a goal to eliminate waste. The Waste Watchers Challenge solicited creative cost-cutting ideas from all employees. In 2012, Ochsner's initial waste reduction efforts yielded a savings of almost $11 million for the system. But we must continue these efforts in order to succeed.
Our doctors and our employees have all the answers to figure out how we're going to approach the next 10 years. We got to engage them more, and we got to be more transparent with our issues, our challenges, and our opportunities so they can help us figure it out.
Every day when people come to work, we want them thinking about ways we can become more efficient and take costs out of our system so that we can be affordable in this new environment. It's not something that we basically would like to do, it's something that we have to do.
Whatever you think you need, think fourfold, because it won't take long before you're going to outgrow whatever size building you have.
We continue to take the lead in healthcare today by creating the infrastructure for future success. As established by the founders, Ochsner continues to build on a strong foundation of medical research, education, and technology. In 2012, a leading-edge clinical trials unit was opened at Ochsner Baptist, and 356 clinical trials were conducted across the system.
By being part of the early development phase, we will now be leading the process rather than following.
Promoting a preventive health and wellness message to the community has been Ochsner's strategy for combating disease early on. This message also prompted Dr. Patrick Quinlan to form the Ochsner Center for Community Wellness and Health Policy.
As an institute, we've decided to have a particular focus on those things that make people sick so that they can avoid the illness in the first place, here in the institution and in the community.
To further show dedication to its patients, Ochsner launched EPIC, a cutting-edge electronic medical record system which launched initially on the North Shore and is now live in 37 locations within the Ochsner Health System. We are connecting over 1 million patients to our world-class healthcare. This was no easy task. The transition was only successful through the efforts of 300 support personnel and countless hours of hard work by physicians, nurses, and staff. And our efforts have paid off. Not only have we launched this new system, we have begun to optimize to its full capabilities. In fact, 100% of eligible Ochsner physicians achieved meaningful use in 2012.
And I can't tell you how great our staff has been, all the physicians, providers, nursing staff, and accommodating all the training and being enthusiastic about learning EPIC and about implementing EPIC. It's a great group to work with. Ochsner's got the best employees of any place in the country. Really, if it's going to be a success, it'll be highly successful here.
Ochsner's founders formed a multidisciplinary group practice that unites physicians and specialties to provide the highest level of care in the world. Ochsner's strength was demonstrated when it successfully performed the first fetal surgery in the region. This cutting-edge procedure harnessed the power of the group practice by bringing together physicians and medical teams from over 8 specialties.
That's the good thing about Ochsner is that we have a pediatric neurosurgeon, we have a pediatric cardiologist, we have a high-risk pregnancy doctor, we have high-risk anesthesia. We've got everything that we need here.
I think it's definitely a landmark procedure for Ochsner, but it's also a landmark procedure for the state. I think this is the first in the state, if not the region. Currently, there are less than 10 programs in the country, and that's because it does require quite a bit of expertise. I think that this really does highlight what Ochsner does well, which is to bring together a lot of high-end subspecialists into one area.
Ochsner has always been on the forefront in a number of areas of trying to do things that are game changers, really make a difference for the patient. And over the years, there have been some of those in adults and some of those in children, and this is one that is really going to be a great advance for children.
With over 800 physicians and 13,500 employees, all working together, Ochsner is a leader in healthcare and is ready for all that the future holds.
I'm so proud of the work we do at Ochsner. This past year, our system performed remarkably in many areas. However, there is still much hard work and improvement to be done. Ochsner's founders found strength and stability in a vision for a better way to take care of their patients. There are many things that we have to do going forward, but we can't do any of them without maintaining our focus on excellent patient care. That has not and will never change. What we do at Ochsner matters. Every day, across the region, patients and families count on us to be there for them. Together, we will continue to take great care of our patients and to change and save lives.
It's the comfort, just being here. Somebody taking care of you.
They have treated us more like family.
Every single person, they wanted to know my story and how I felt, and I just was so impressed with that.
If I ever have anything wrong with me, I'm going to Ochsner, I'm going to be honest with you, because, you know, he made me feel comfortable, made me feel I was cared about, you know, and I wasn't just a chart on the wall.
I said, if you know anybody who needs any kind of transplant, contact Ochsner. They did. They saved me.
Ochsner's wonderful physicians and the technology that Ochsner has was able to extend 4 years so where the 4-year-old could have the memories of her father.
I was fed hope from the time I walked through the door the first time, and I still share that hope with everybody I meet wherever I go. Ochsner's is the place to be.